lot of people have doubt that whether they have diabetes or whether they don't have diabetes. In this video, we are going to learn how we can diagnose diabetes. And if you are already having diabetes, what are the tests that you need to do to monitor your blood sugars? We are going to learn in this video. There are few tests that are done in diabetes. First thing is fasting blood sugar levels. Fasting blood sugar levels is the blood sugars which are measured after overnight fasting of 8 hours. It is generally measured in the morning before you take your breakfast or tea. Normal fasting blood sugar levels should be less than 100. If your blood sugars are from 100 to 126, that indicates that you are in pre-diabetes condition. If your fasting sugars are above 126, that indicates you have diabetes. There is another test, something called postprandial blood sugars. That is done after 2 hours of taking your breakfast or the lunch. Your postprandial blood sugars level should be less than 140. If your postprandial blood sugars, that means after your breakfast or the lunch, 2 hours, if your sugars are from 140 to 199, that indicates that you are in pre-diabetes condition. If your postprandial sugars are above 200, that indicates that you are having diabetes. But the problem with fasting and post sugars is when we are checking these fasting and post sugars, we are a bit careful and we eat healthy foods. We don't eat any sweets or the junk food or the processed foods to make sure that we get good values in our blood sugars when we check fasting and post sugars. So fasting and post sugars deceives us because this fasting and post sugar blood sugars level depends upon the foods that you ate on that day. Okay. So what is the most accurate test to diagnose or to know the status of diabetes? There is something called HbA1c or glycated hemoglobin. This HbA1c is an accurate test to diagnose blood sugar. So what is this HbA1c? This HbA1c is, in our blood, we have red blood cells which carries the oxygen. These red blood cells have hemoglobin molecule in them. So when the blood sugar levels are increased in the blood, so sugars get attached with the hemoglobin molecules. So when your HbA1c levels are below 5.7, that indicates you are non-diabetic, you have normal sugars. If your HbA1c levels are from 5.7 to 6.4, that indicates you are in pre-diabetes condition. If your HbA1c levels are above 6.5, that indicates you have diabetes. As the value of HbA1c levels are increasing, that indicates you have poorly controlled diabetes. If your HbA1c levels are above 10, that indicates you have very poorly controlled diabetes that increases your risk of getting a lot of complications. Complications like heart problems, kidney problems, and the brain strokes, neuropathies, retinopathy. So, how frequently you need to do HbA1c levels if you have diabetes? You need to check at least yearly twice if you are a patient with diabetes. HbA1c will indicate us average sugars of 2 to 3 months. So you can give the blood sample at any point of time. There is no need for you to give fasting sample. At any point of the day, you can give the blood sample for HbA1c. So if your HbA1c levels are in diabetic range, or if your HbA1c levels are above 9, 10, then you need to make changes in the lifestyle so that you'll be able to control the blood sugars, you'll be able to reduce your HbA1c. Because as you reduce your HbA1c levels, you'll be able to prevent a lot of complications that happens because of uncontrolled diabetes. I want you to type in the comments when you have checked your blood sugars or HbA1c. Why? Because in India, we have more than 7.7 crore people having diabetes. But the thing is, in India, we have more than 10 crore people apart from the 7.7 crore people who are having diabetes, but they don't know that they have diabetes. Why? Because in most of the cases, diabetes doesn't cause any symptoms. So it is undiagnosed in most of the patients. Okay. So it is very important for you to check your blood sugars if you are above 35 years, at least yearly twice, so that you will come to know if you are in pre-diabetes condition or if you are already having diabetes, so that you'll be able to make changes in the lifestyle, so you'll be able to reverse the diabetes, or if you are in pre-diabetes condition, you'll be able to prevent landing in diabetes. So check your blood sugar levels at least 6 months once. Another thing is, if you are a diabetic patient, you should have a glucometer in your home. That will be helpful for you to monitor blood sugars at home. That is an investment you are doing on your health. Thank you so much.